in curry, among other foods, contains the compound curcumin. Turmeric is the spice that gives curry the yellow color. Curcumin has been found in several studies to inhibit the invasive ability of lung cancer cells. 7. Curcumin has been looked at for some time with cancer, as it appears to have antioxidant, anti-inflammatory, and immune stimulatory effects in addition to facilitating cell death, apoptosis, in cancer cells. The American Cancer Society has stated that lab and animal tests on turmeric look very promising, but is hesitant to recommend this spice for prevention or treatment. For those who are currently undergoing treatment for cancer, the news is good as well. Curcumin may work to make tumors more sensitive to the effects of treatment with chemotherapy and radiation therapy, especially with medications such as the common lung cancer chemotherapy drug cisplatin. In addition to cancer prevention and treatment, turmeric is being studied for its role in a wide variety of health conditions, even its potential role in Alzheimer's disease. 8. Until that time, and since we are discussing dietary sources alone, it probably can't hurt to add a few foods containing this colorful spice to your diet. It's very important to note that relatively large quantities of curcumin supplements need to be taken in order to be absorbed. 3 studies showed that at 1.8 grams of curcumin per day as a supplement, curcumin has very poor availability and is undetected in the blood of patients that receive it. On the other hand, when cooked as curry, curcumin has a better availability and is better absorbed. 7. Berries are low in sugar and high in many nutrients. Berries such as blueberries, raspberries, blackberries, and cranberries are loaded with compounds known as anthocyanidins. One form of anthocyanidin, known as delphinidin, made a significant difference for mice inoculated with EGFR mutated human lung cancer cells. 9. If you are not familiar with EGFR or have not had molecular profiling done on your lung cancer, make sure to talk to your healthcare provider. Dietary delphinidin inhibited the growth of the tumors, limited the ability of the tumors to create new blood vessels in order to expand, something known as angiogenesis, and induced cell death, apoptosis, among the cancer cells. An added benefit are studies finding that anthocyanidins may help prevent the formation of blood clots, thrombosis. Considering that 3% to 15% of people with lung cancer develop blood clots, and that this is associated with an increased rate of death from the disease, berries may help in more ways than one. 8. Carrots. Carrots contain a compound that may inhibit angiogenesis in lung cancer cells, a process necessary for tumors to grow. Carrots are an excellent source of a phytochemical known as chlorogenic acid. In order for tumors to grow and invade tissues, they must grow new blood vessels to supply the tumor. Some treatments for cancer are designed to interrupt this process, which is called angiogenesis. In other words, if the tumor is unable to